Thank you again for joining us for this webinar, The Secrets of a Superstar Stud Dog, Part 2. In this webinar, Revival's Director of Veterinary Services, Dr. Marty Greer, will be sharing her knowledge on male dog reproductive health. Now, we do want to give a quick disclaimer on this webinar. Some of the images shown during the presentation might be graphic, so just want to give you a heads up on that. Now, Dr. Greer has more than 40 years of experience in veterinary medicine with special interests in canine reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she has served as our Director of Veterinary Services since 2019. So thank you again for joining us today, Dr. Greer.
Thanks, everybody. So I'm glad to have you all here. This is going to be fun. We're going to go through the second half of the material that we covered the other day. So we're going to start talking about the semen delivery. We talked about more of the general information about how to do the collection, how to analyze the collection, all those bits and pieces the last time we were together. So today we're going to talk about the semen delivery, scratching the surface, which is going to be preventives, flea and tick preventives, and heartworm preventives. Stud dog variation changes the spice of life, supplements, supper, and snacks, surroundings, and shampoos. And then the diagnostic workup and treatment care plan. And then the AKC purebred preservation bank will just be a very small section at the end. So I want to give everybody a fair chance to listen to all this great stuff. So semen collection and delivery, we talked about how to collect the stud dog last time. We showed some video of that. So if you did miss that, please go back and view it. It's in the Learning Center, so it's not inaccessible to you. All you have to do is go click on that and you can see it. So semen delivery comes in 5 different versions. It comes with a natural mating, so just a tie. Comes with a vaginal insemination, AI here being artificial insemination, not artificial intelligence, which people talk about AI all the time now. I'm like, oh, they're talking about artificial intelligence. Not that interesting. The Mavic catheter is a way to deliver semen, transcervical insemination, TCI, and surgical inseminations. So there are basically 3 kinds of semen. There's fresh semen, there's fresh chilled or fresh cooled semen, and there's frozen semen. They're all different in how they get handled. They're all different in how we manage these. So we want to make sure that everybody understands all the nomenclature and all the language that we're using. So a fresh AI is when you have the dog and the bitch on the same premises, and for whatever reason, you don't do a mating. The male can't accomplish it. The female's not cooperative. She's got a stricture. He's shy. She's bold. She's shy. He's bold. He's too tall. She's too short. You know, a lot of different things happen. He might have some discomfort, some pain. There's a lot of reasons that we do artificial inseminations. Second would be fresh chilled, and that's a way that we can ship semen. So we collect it, put it with extender, put it in a box, and ship it overnight. US Postal Service, UPS, FedEx, whatever. But this way you can use stud dogs that are inaccessible to you geographically, that are maybe across the country, maybe outside the country. And we can use these stud dogs on females without having to ship the bitch or ship the stud dog or drive, you know, halfway across the country. And trust me, we still have people that do that. Then we have frozen semen, which is a very specialized technique, and only a few veterinarians in the country, probably around 100 veterinarians in the country in the US have the ability to do the freezing and storage. This is when the stud dog no longer has to be available. He can be deceased, he can be neutered, he can be sick, he can be perfect and still use frozen semen. But it is an option as a way that you can have semen available at the drop of a hat. So instead of having to say the stud dog's off being shown or off camping in Montana or whatever, you can use his semen without having to worry about accessibility to him. When we do the frozen semen breedings, the semen needs to be put in either surgically or with transcervical insemination. Vaginal inseminations don't work. And then surgical insemination is a way that we manage male and female dogs that may have compromised fertility. And we're going to go through each of these one at a time. So the secrets to our superstar studs start off with, of course, picking the right male and the right female. One of my clients sent me this photograph. Apparently she didn't have enough to do because her dogs had time to get married. Most people don't have their dogs get married before they breed them. So the 3 kinds of semen, we're going to start with fresh. And to do a fresh artificial insemination, you need a collection sleeve to collect the semen in, which we talked about last time, an AI pipette, and a sleeve with the semen in it with a syringe. And we usually recommend a syringe that doesn't have the black latex stopper. And then the technique requires that you have some cooperation from the female, and we'll show you in just a second how to do that. And then some lube, like the Priority Care lube, so that the pipette slides into her vagina easily. So once the semen is collected, we'll do the artificial insemination, which I'll show you in a few minutes. Fresh chilled semen means that we collect the semen, put it with extender, a specialized extender to use for shipping. And we do carry these all at Revival, a box with ice packs in it. It's a styrofoam lined cardboard box with ice packs. So we put a frozen pack, a chilled pack, and then the semen in that box with it. And then, like I said, it can be shipped through UPS, FedEx, Postal Service. If you have another service that delivers packages, that's great. Pretty soon, Amazon will probably do it, but not yet. So you're pretty much left with those three options. Unless you have somebody like Speedy Delivery, there's smaller companies around the country that do some of these delivery services. So how do you manage a fresh chilled semen shipment? Requires a special box. It requires special extender. What I love about being able to do fresh cooled or fresh chilled semen is this is something you can do yourself. You don't have to have a veterinarian involved. It is a good idea to have a way to do a semen analysis, either a microscope or the iSperm, so that you know that you're sending good quality semen before you package it and spend somebody's money on shipping it. But you can do this yourselves. And this is a way that you can extend your stud dog's ability to breed to bitches all over the country without having them shipped in or without having to drive somewhere. It's a nice income stream. If you have a nice little stud dog that you imported or that has been a valuable stud dog for a variety of different reasons, this is a nice income stream because you can charge people a stud fee, plus they'll cover the cost. It's typically the bitch, the recipient, that's going to pay for the box, the collection, the shipment, all those things, plus the stud fee. So this may be something that you can charge people $2,000 or $3,000, maybe $5,000 for, depending on your stud dog. And you don't have to go anywhere. You just have to collect the dog, package the semen, put it in a box, and then let the FedEx truck or the UPS truck take it the rest of the way. So it's a pretty nice income stream if you have a valuable stud dog or a dog that you want to promote to other people. So it does take, like I said, a styrofoam lined box. We do put extender in it. We do put the tubes in a special packaging. And then we have the frozen semen type of breeding. This does require a clinic to do the freezing. Most people that freeze semen are veterinarians, but not all. Some of them are experienced with freezing semen in other ways. They may be a member of International Canine Semen Bank. They may be part of Clone, Camelot. There's a couple of different companies that do semen freezing, but you want to use a clinic and a doctor that has experience with freezing the semen and with administering the semen, so it's thawed correctly and it's inseminated correctly. It costs a lot of money to do frozen semen. It costs more to ship the tank than it costs to ship a fresh chilled box. It costs several $100s instead of around $100. And it does require either a surgical breeding or a transcervical insemination to accomplish the breeding. So you do want to work with somebody that has experience. You don't want them to say, well, yeah, I'll try it. That'd be kind of cool. This is my first time, but I'll give it a try. I mean, we all started off our first time somewhere along the way, but it should be someone that's had some mentorship with a clinic that does this so that you know that you're getting the best outcome that you possibly can. So like I said, there's a couple of ways for semen to be delivered. There's natural, vaginal, that includes the Mavic catheter, the TCI, and the surgical. So this chart kind of summarizes it for you so that you can see a natural breeding obviously has to be fresh semen because there's no other way to go from the boy into the girl with a tie unless it's fresh semen. Vaginal inseminations, we can do both fresh semen and fresh chilled semen, fresh cooled semen. Transcervical inseminations, we can use all three types of semen, fresh chilled, and frozen. In our practice, we do TCIs on all three of these and we do them all frequently. Why would somebody want to do a fresh chilled or a fresh chilled insemination with transcervical insemination? Because it delivers the semen directly into the uterus instead of vaginally. So it gives the semen a head start to get all the way up to the oviducts where fertilization takes place. They have to swim all the way up to about the end of the dog's rib cage, the female's rib cage. So that gets the semen further along. So if you have a female with questionable fertility, a male with a low sperm count, a male that you've shipped semen on, you've gone to a lot of trouble, you want to make sure that she gets pregnant. And then surgical breedings, again, we can use all three kinds of semen. And there will be times that we would recommend a surgical breeding if you have really poor quality semen. It's the last unit of frozen semen left in the world, and you have to get the female pregnant. If it's a female that's had a history of fertility issues, those are all opportunities that we can use to improve the chances that we have a good quality breeding. Multiple sire breedings are kind of interesting because that's when we use more than one boy. to breed a female, and it is okay to do. AKC allows you to do it as long as you DNA test. So there are definitely ways that we can make this happen and reasons that we want to. We have people that'll be like, well, I couldn't really decide between the two boys, or the one boy I really like doesn't have great semen quality, so I'm going to augment it with a second boy that has better quality semen. So you can do those as long as you DNA test and know who the sire is. Then you can still register puppies with AKC, UKC, or other organizations as long as the DNA testing verifies the stud dog that sired each individual puppy. Now, I have had people say, well, I've heard that only one dog ever gets the female pregnant, so why would I use two? And the answer is, it doesn't always work that way. I personally have done 2 multiple sire breedings on my corgis. One, yes, they were all from one sire. The other, I had 1 puppy from one sire and 3 puppies from the other. So you can definitely have multiple sires successfully have outcomes. So it does give you a chance to get some more variety. So natural breedings, of course, require a tie. These again are pictures sent to me by my clients. These are her duck-tolling retrievers. And apparently they were dating and having some beverages before they decided to breed. So he was whining and dining her. Good for him. That's the way the boys should do it. This is a Wisconsin tie. So this is one of my clients with Shiba Inus, and her dogs had tied. As you can see, it's winter and a little bit chilly out there. So she had them in a tie and realized that they were going to be there for a while. So she tried to make them as comfortable as possible so that while they were in a tie, they weren't too cold. So this is a really nice, considerate owner. These are some of my corgis, and they do not always successfully manage to get a breeding. Obviously, the female is standing. She's flagging for him as much as a dog can flag without a tail. He's very interested in her. This is good timing. This is the way it should work. So he's doing some courting behavior. This is all normal for him to go over and kind of test the waters by poking his nose at her, putting his chin over her back, kind of seeing if she's receptive before he makes the commitment. So he's making some efforts here to do the breeding, and unfortunately he was less coordinated than would have been ideal. So we ended up doing an artificial insemination to get this to happen. But kind of interesting little note here is that historically we've always said, well, the male does all the work. He has to do all the courting. He has to do all this stuff. Well, Ian Dunbar and other people have shown, Ian Dunbar is a behaviorist out in California, have shown that the female plays a really crucial role in her position and her willingness to allow the male to do the breeding. So you can see that she's cooperative and she's trying to line herself up. So it's not just that the boy has to figure this out, but she's going to try and help line things up so that he has a better opportunity to get the breeding done. At times you may have a temperament issue that she may not be cooperative. She may not be ready because you didn't progesterone test. So you don't know where she is in her heat cycle. He may be a little shy, or she may be a little bold, or she may be a little snarky. It may be that one of them is taller than the other. And so size wise, they don't quite fit. Like we talked about last time, the male may have some back pain or some joint pain. So those are all reasons that we sometimes have to intervene to get a breeding to happen. Sometimes we have French bulldogs and other breeds that just aren't wildly successful in getting aligned and getting things to happen. It is true that Frenchies can breed on their own. It is true that bulldogs can breed on their own. So just because you have a Frenchie or a bulldog, don't assume that you can leave them together safely in the same room while the female's in heat, because you may come home and find a surprise litter of puppies. So just because they're Frenchies or bulldogs or pugs or whatever, you can still get natural breeding. So be aware of that. But sometimes you just have a boy that's inexperienced, or he's not too bright and she's not too cooperative. So sometimes you just have to say, I give up. We're going to do an artificial insemination. And it's always best to do an AI, and then you can sit back and relax. And if you get a tie the next day, great, you get a tie. If you didn't, you don't have to keep staring at the dogs and, kind of putting social pressure on them to make this happen. You can sit in your lawn chair and, have a nice drink and watch them and see if they can get a breeding accomplished. And if they do, great. And if you don't, well, you did an AI. So at least you've got semen in the right place. What you don't want to do is let the male try so many times that he ejaculates on the floor or wears himself out or otherwise exhausts himself and end up with a poor quality artificial insemination because the semen was all over her hair and the floor and everywhere else. So stop that intervention, stop and intervene soon enough that you can helpfully get a successful breeding. Semen delivery, of course, we can do vaginal inseminations. These are something that you can do at home yourself. The most important thing that you know about these is that when you insert the pipette into the female, you want to angle it up at about a 45-degree angle from between her back feet up toward the tail and the pelvis, and then redirect it to go forward. If you just try to go straight in, that's not the way her reproductive tract is shaped. You have to go up and over the pelvis. So make sure that when you're doing these breedings that you accurately aim the direction. This is an old picture of Trish and me back when both of us weren't gray. And we've got the female, as you can see, on an elevated ramp just to improve the chances that the semen can get up into the uterus. So we're inserting the pipette and then doing some feathering on her when she's elevated. This is a little coton, and again, she's on a ramp, and you can see that the pipette is going in, but first it went up and then it went forward. The other alternative to a vaginal insemination is to use a Mavic catheter. And again, you can purchase these without having to be a veterinarian. These you insert into the vagina of the female, and they come in different sizes. As you can see, they have a little stylet in them to help you advance them. You slide it up and then forward, and then you inflate the balloon. The balloon is thought to do two things. One, it's thought to stimulate the tie of the male dog so that it helps the bitch to have some contractions that will help propel the semen forward into the reproductive tract. And the second is you can leave that in for 20 or 30 minutes. Just don't let the female go running around the floor. You want to keep her under control. So that, again, blocks the outflow of semen so that it has a better chance to advance up into the bitch's reproductive tract. So that's kind of a nice way to do it. You can see we're wearing gloves. You can see that we're careful with how we handle this female. She's a very sweet little dog and was very cooperative at standing on this ramp to keep her hindquarters elevated and hopefully improve the delivery of the semen. Transcervical insemination is typically only done by veterinarians, unlike vaginal AIs and the ones that we've shown you before. Transcervical inseminations require specialized equipment. The equipment runs about $30,000 for the scope, the screen, all the pieces that go with this. In this case, the female is awake. This is one of my corgis. And this is me again before I turn gray. So she's standing on a table, no sedation, just one person steadying her so that she stands still. And we will then insert the camera on the endoscope into the bitch's reproductive tract, advance it, and be able to see that we're in the uterus, and we can then put the semen directly into the uterus itself. So this again is another dog that we're going to show how we do this. This is an Airedale, as you can see. The owner is standing with her as he wanted to be present, and most of the time owners are, because the females are usually happier, more content, and more willing to stand still. The dogs that stand the most still are typically the standard poodles that are used to being groomed, the Dobermans that are used to being handled a lot. A lot of the dogs, this is an Airedale, so she's been handled and shown quite a bit. So she's pretty cooperative. Again, that's the owner. And then Marissa's going to steady her hindquarters. And then Brenda's going to handle the equipment for me. So essentially what we do is we take an item that looks similar to the Mavic catheter. It has a balloon on it. We're going to put that in the bitch's vagina. Again, she's not sedated. She's not anesthetized. You can see she's standing. She's alert. And most bitches in standing heat are very cooperative about doing this. So she's going to stand while we advance the shunt into the vagina. Then I'm going to put some air into the shunt so that it allows air to be insufflated in front of that balloon, making it easier to find the cervix and easier to thread the catheter into the cervix. So here in a minute, and it's kind of weird what happens with video on these TV screens. These are medical grade television screens, and they don't typically show the normal image very well. But here we are. I've got the scope up into the beginning part of her vagina. And you can see on the TV next to me that we can see where the end of the scope is. We're able to see that with the camera. So we're going to very carefully and very slowly advance this up into the bitch's reproductive tract. And then once we see where the cervix is, which I've identified here, Brenda's going to hand me the catheter. We're going to slide this catheter. Now the scope is 27 centimeters long, and this catheter is longer than that. It's about 40 centimeters long. We're going to slide that up into the scope. I'm going to align it with where the cervix is. And again, because of the medical grade of this, it doesn't show as clearly as you can see it in person, but we can see her cervix. It's right in front of me. We're going to position this so that it'll slide in. The cervix is at about a 70-degree angle, so it actually shows up. You can see that the catheter is now advancing. And Brenda's turned the TV here so you can see it. So you can see the catheter in the cervix. The cervix looks sort of like a rose, but it's got an orange peel kind of surface to it, kind of bumpy. And then I'm going to put this connector on so that I can inseminate with the semen. If this were frozen semen, we would not thaw the semen until we were cannulated into the cervix. If it's, in this case, it's fresh chilled semen, so it was prepared and ready to go. So at this point, I'm going to just make sure that everything's lined up correctly, that you can see. And then I'm going to take the syringe from Brenda and then slowly inseminate the semen up into the uterus. So we're in one uterine horn. It's blind, so I can't tell you if it's the right or the left horn, but we're going to tell you it's in one uterine horn. And then I'm just going to hook this up and we're going to slowly inseminate the bitch. And she, like I said, stands throughout all of this. So it's actually kind of fun to watch. You can see a little bit of bubbling going on there on the screen as some of the air bubbles out. And then we're just going to very slowly put the semen in. I want to do this over a few minutes time so that the uterus has a chance to expand and accommodate the amount of semen that we're going to put in. So that's transcervical insemination, or TCI. With TCIs and frozen semen, this is a litter of puppies that we shipped semen from Wisconsin. We had Malamute that was in Wisconsin, and the people in Norway wanted semen from this dog. So as you can see, Norwegian puppies are just as naughty as US puppies. This one's trying to tear into a bag of dog food. The other ones are tearing up the kitchen. So typical puppies, but these are Wisconsin stud dog puppies in Norway without shipping. Surgical insemination is our fourth and final choice. This is sort of a series of pictures that shows, this was 6:20 at night. I don't do anything at 6:20 in the morning except have breakfast. So at this point, we have the female. She's come up from Illinois. We're going to do a breeding. So we start the semen collection here at 6:20. So this was, again, a long time ago, but we still do these. So I've got semen in the tube. I'm checking it under the microscope because we want to make sure before we go to surgery, we have good quality semen. We've done a sperm count with the mini tube spermicube. We've added extender to the semen. Here, Chris is holding the dog for an IV catheter because we're going to anesthetize her. Here we are placing the catheter, prepping her for surgery. Here she is on the surgery table. My client took all these photographs, so when you see the next picture, don't be horrified. I wasn't doing anything pornographic. This was her own dog. We have the bitch's hind end up on a set of towels to keep her elevated. This is her shaved and ready to go. Anesthesia, of course. This is my husband running anesthesia. I'm scrubbed in. This is her view from the surgery room. Outside the surgery room through the glass, she can see where everything's lined up. So we have the anesthetic machine, the fluids, the bitch is anesthetized. We're ready to go to surgery. We make a small incision, about 1.5 inches long. We exteriorize the uterus. So this is the uterus with one horn in each hand. And then the uterine body is off to my right, or my left, your right on the picture. So you can see that. We're going to place an IV catheter into the uterine body. And then we're going to slowly inseminate the semen into the uterus with extended semen. So that's where the catheter goes into the uterus. I'm pushing the semen through the syringe into the uterus, sewing her up, stapling her closed. You can see that this takes a very short period of time. It's a procedure that we do pretty frequently, so it's not a long procedure. Here she is recovering, and this is kind of the coolest thing, is you could now see that she was successfully pregnant. She had babies, and these are her puppies. Yes, she is a Gordon setter. Yes, those are red puppies. I didn't know Gordon setters came in red. I thought only Irish setters came in red, but she had a litter of both black and tan and red Irish setter babies, or Gordon setter babies. So this is how the surgical insemination works. So again, surgical delivery obviously is done by veterinarians. Okay, so that's putting the semen in. Now I want to talk briefly about scratching the surface parasite control, because I think it's really important that you know for your breeding dogs, male and female, that we need to be very careful with the external and internal parasite control products that we're using. For external products, for fleas and ticks, we want to use one of the products that's labeled as safe for breeding animals, and that will include Bravecto, Revolution, Frontline. It does not include the Seresto collar. It does not include Vectra. So about half of the topical products are not labeled as safe in breeding dogs. About half are. Of the 4 oral medications, and there are 4 right now, we have Simparica, Credelio, and NexGard. None of those 3 have been tested in breeding animals. That includes NexGard Plus, that includes Simparica Trio. So if your dogs are currently on one of those products, be aware that you should have them on a product that is labeled as having been tested in breeding animals. Merck's Bravecto is the only one of those that of the 4 that's been tested. So I'm very adamant that you should support a company that supports breeders. And if Bravecto has been willing to spend the money and do the studies to show that this is safe in breeding animals, that's what you should stick with, because we have no data on Simparica, Credelio, and NexGard. It doesn't mean they're a bad product. It means we don't know what they do in breeding animals. So I don't want your dog to be the footnote in the paper that says, oh yeah, and by the way, didn't work out. So I would just stick to the products that we know are safe. Now on here, we have a QR code that you can very easily go to, and it takes you to one of our sub pages on our Revival Animal Health website. You can do it with the QR code, or you can just type in the flea tick finder, and it will walk you through how old is your dog, what breed is your dog, are they being used for breeding, what all of the information bits and pieces are. So it will walk you through and help you determine which flea and tick products are going to be most appropriate for your dogs. As far as parasite control for internal parasites, that'll include roundworms, hookworms, tapeworms, and of course our favorite, heartworm. And every preventive that we have on the market, except for Trifexis, to my knowledge, is tested and safe in breeding animals. So that's going to be Interceptor, Sentinel, not the Bravecto, Simparica, those products, because those aren't tested. HeartGuard, including the ProHeart 12, that's the injectable that lasts for 12 months. All of those have been tested and found to be safe. Now, if you have a question about this, you can Google search the name of the product and type in product insert PDF, and it will bring up the PDF, which is that giant piece of paper that you unfold when you open a package, just like a map. You can never fold it up again because it's all weird and you'll never stuff it back in the box. But you can Google those, and you can just do a Control F and type in pregnant, breeding, any of those words, and it'll bring up that information for you. So if your veterinarian isn't giving you this information, you can either email us and get the chart, or you can Google it yourself and take a look. So you don't have to take my word for it. You are absolutely welcome to go in and take a look at those products. So when I talk about a breeding dog, I mean all breeding dogs. I don't mean when she's pregnant, she's 2.5 years old and she's pregnant with her first litter. I mean all breeding dogs. This is a male puppy. You can see he's got boy parts underneath him. He is a breeding dog. If he is going to be used when he's 2 years old as a breeder, he should not be on products that are not tested and found to be safe. So please, please, please stick to those products. And if you don't think your veterinarian is giving you accurate information, just Google it and take a look at the PDF. All right, next we want to talk about stud dog variation, because at some point you can't use the same boy over and over and over many generations in a row. So we're going to talk about trading stud dogs, extended semen again, frequency, overuse, and age of your stud dog. So when you're swapping out dogs, whether you're trading a dog or you're paying somebody a stud fee to use their stud dog, you're shipping semen, whatever it happens to be, anytime you're using a dog from outside of your own facility or your own kennel, you really need to talk about brucellosis testing. It's absolutely essential. It's a bacterial disease that we can see that is spread venereally and in other body fluids. So it's very important that you're paying attention to brucellosis testing. The problem is we used to have a kit on the market, and for many, many years, over 40 years, we had a really nice test kit that was not as specific as it should be, but it was very sensitive. We never missed a dog with brucellosis because it was so highly sensitive. Sometimes it picked up test results that were actually not positive, and then you just had to do a confirmatory test. However, that kit was made by Zoetis, previously Pfizer. Previous to that, it was Pittman Moore. I mean, it's changed company names a number of times, but it was a really nice test that your vet could run in the office and in 20 minutes give you a result. Well, that test kit disappeared about 3 years ago, and there is currently no FDA approved test kit on the market that your vet can use in their practice. Can you find a kit that tests for brucellosis? Yes, you can. Is it FDA approved? No, it is not. They're made in China. We don't know anything about the accuracy of these tests. So we're recommending that you use a reference lab, either your state reference lab, which should have the ability to verify that their tests are able to pick up negative and positive controls. So you know your test is accurate. If you're not sure, Cornell has a multiplex test that's very useful and very accurate. So it's very important that you're not overlooking this step. So if you have a bitch that you're planning to breed and you have a stud dog picked out, start planning to do this test about 2 weeks ahead of time, either the day one she comes into heat or preferably prior to that, because you're not going to get results back in 24 hours anymore. It's going to take sometimes a week, sometimes 2 weeks. So plan ahead so that you have this brucellosis testing done. Every year I talk to someone that has brucellosis in their kennel, and it's absolutely devastating. It allows the state to come in most states, test all your dogs every 30 days for a total of 90-day tests. So 3 tests. If your dogs are persistently positive, they have the permission, the state in that you live in, most of them have the authority to euthanize all of your dogs. So do not lose your breeding colony of dogs because you were too inexperienced or too late or too whatever to brucellosis test. So don't take any chances on it. Brucellosis is still a real thing. We see it in native dogs. We see it in imported dogs. Don't be careless about this. A couple of years ago, we had them imported into Wisconsin from South Korea. We see them showing up every year someplace in the country. So do not take a chance on this. Have your dog's brucellosis tested. Next, of course, we have the extended semen. We've already talked about fresh and frozen semen as a way to vary your stud dog without having to purchase a new stud. So it's a nice way to use other dogs from other people's breeding kennels without having to travel. If you are planning to use extended semen, you want to plan ahead. The same with frozen semen. You want to order your shipping kit well in advance, have your extender, your kit, all your stuff ready. If you have an ice pack, have it one frozen, one in the fridge. Don't be running around at the last minute trying to get an ice pack to freeze because they take 24 hours. Make sure that you've adequately timed the female with progesterone testing so you know when to ship. As soon as she comes into heat, you want to call the stud dog owner and make arrangements for them to collect the semen. Either they can collect it themselves, AKC allows that, or you want to talk to the veterinarian that will be doing the collection. Plan the shipment. You need to ship it overnight. So make sure that you're using a service that has overnight service. And if you're shipping on a Friday and you want Saturday delivery, you need to put the little box in the X that says Saturday delivery. Otherwise, it won't come until Tuesday. And you're going to be very sad if you miss a shipment. So make sure those Friday, maybe even Thursday shipments that you mark Saturday delivery in the box. You used to be able to do airline counter-to-counter shipments, but those have largely gone away because of 9/11. That was a thing of the past that now they don't trust people to ship packages on airplanes. At the last minute, you may end up having a panic if the stud dog's in Montana, if the shipment gets lost. I mean, these things all happen. We're now putting air tags in the box so that we can track the box. UPS and FedEx can only track to a certain extent. They can tell you where the package is scanned last. They can tell you what's on a truck, but they can't tell you exactly where it is. So a $25 air tag may save you a lot of grief in trying to figure out if that package is going to get to you in time. At the last minute, you might have to make a change of stud dogs, either with a different stud dog or different kind of semen. Hopefully that doesn't happen to you, but unfortunately it does occur from time to time with fresh, chilled, and frozen semen shipments. And as soon as the semen gets there, you should inseminate. If the bitch looks like she's going to ovulate on Sunday and you can get the semen on Saturday, put it in the bitch. Refrigerators don't get pregnant, dogs do. The uterus is where semen belongs, not swimming around in a tube in the fridge. So as soon as that semen comes, go ahead and put it in the bitch. The semen's going to live longer in the female than it's going to live in a tube in the refrigerator. Again, stud dog variation, you want to make sure that if you're using a stud dog and he's used for multiple bitches during heat cycles, that you give him enough of a chance to rest in between breedings. We get the maximum sperm production if we wait 5 to 7 days between collections. But if you have multiple females that are being bred to him, you may need to do a daily collection. Sometimes people split them if they have enough sperm count, if the sperm count is high enough, and they may use it on more than one female, and that can be successful. It's an especially good idea at this point to have a sperm count so you know exactly how many sperm are in the collection and what the quality of it is. But if you collect him too many days in a row for too many times, you're eventually going to deplete his reserves and his epididymis, and he's going to wear out. So be sure that you're timing the female and you're only breeding her when she's at her peak fertility, not just breeding every day, and then having him exhausted, especially the older dogs will deplete their semen reserves. And then when you finally get to her perfect day, he's down to really having such a low count that it's not going to be successful. So it's really important that you do time the females. So collecting too often can really deplete these guys. And obviously there's only so many dogs in one generation and second generation that you can breed to that stud dog. We don't recommend breeding father to daughter or brother to sister. We don't recommend those breedings, but a lot of people do a grandfather granddaughter breeding, and that can work really well. So if you have a nice stud dog, you have a nice number of females from him, don't breed the girls to the dad, but take those girls' daughters and breed back to grandfather. And the classic line that we have for this line breeding, which is acceptable in AKC, is let the sire of the sire become the grandsire on the dam's side. So in other words, breed her back to her maternal grandfather. And you can get some really nice breedings. You can't do that too often, or you get so tight in your line breeding that you get into trouble. You don't have enough genetic diversity, but doing it once here and there can really stamp your breed with a beautiful appearance if you've got an appearance that you really like. On the other hand, it can also show up some things that can be kind of ugly. So you may find that if you do that, you're going to find things you didn't know you had, but at least you find that out. So the sire of the sire becomes the grandsire on the dam side can be a very useful line breeding technique on a limited basis. After age 12, if we have a stud dog that's more than 12 years old, AKC requires to register the litter, that you have a veterinarian's letter that says he's still able to produce semen. Under age 12, you can do that. And of course, you're not going to breed a bitch after age 12. So I really only mean for the boys. And I like breeding old males. I think if they are still capable of producing sperm, they're healthy, they're able to stand, walk, collect semen, hey, go for it. Everybody wants dogs that live to be old, and longevity does have a heritability to it. So if you have a 12-year-old or a 13-year-old dog that's still making sperm and you like what you've gotten out of him, go for it, man. Let's let him be the sire of the next litter. People want to buy dogs that are going to live to be old. So let them buy dogs that were sired by older males, because that helps to ensure that there will be less likelihood of behavior problems, orthopedic disease, cancer, seizures, all the nasty stuff that we see happens as aging dogs go on, that we can be more assured that that stud dog that's still 12 and up, and he's still healthy and he's still producing sperm, he's producing healthy puppies. A lot of dogs by age 5 and up will end up with prostate disease, especially if they're housed with females. So you may need to manage that. And we've talked about prostate disease at another time, so we're not going to cover that in detail today. But Bernese Mountain Dogs and Greater Swiss Mountain Dogs, they have a tendency to develop prostatic disease when they're younger. And now we have supplements, suppers, and snacks. So you've seen that everything here starts with an S, our secrets to a superstar stud. So I hope you've kind of gotten the theme of this. So we're going to talk about nutrition and supplements. The most important thing is that you take a great diet to your stud dogs and your bitches. You can't take a crummy diet and turn it into a great diet by adding supplements. So do the right thing, buy the right food, and get them started on something that has not just the macronutrients in it, the fat, carbohydrate, and protein in it that you need to make your dogs look good, but you also have the micronutrients. And reading a label on pet food can be very difficult to figure out the micronutrients. You can't figure out how much zinc and how much thiamine and some of those things are in food because it's really not listed accurately on a label. So my best successes have been with using either a Royal Canin diet, and in this particular case, this is the HT42D, which is designed for females during pregnancy, but it has an anti-inflammatory ratio of fatty acids in it that appears to help our stud dogs have better quality semen. So if you're struggling with a male dog, you can order this. You can't get it at retail. The only place you can get HT42D is on the Royal Canin Crown Partners website, but that is the only pregnancy diet on the market. If you're having a difficult time with Royal Canin, then you can go to the Purina Sport 3020, the performance diet. So those two diets are the ones that I see the best successes in fertility with. So if you're struggling with fertility, male or female, the first thing I recommend that you do is change the diet. Well, right after brucellosis testing, change the diet. This is how HT42D is produced. They put all these micronutrients, which are vitamins, minerals, and amino acids into it that help allow for better heat cycles, better follicle growth, which are the eggs, better ovulation, better fertilization. Nidation is the formation of the placenta, embryogenesis, and then maintenance of the gestation. So this is fed from the start of the heat cycle to the 42nd day of pregnancy for females. For male dogs, you can feed it through their entire breeding career. Supplements, we have several really nice supplements at Revival that are produced by Revival. We have 4. We have Breeder's Edge Problem Male. It's a combination of perna mussel, which is a green lip mussel, little shellfish, DHA, L-carnitine, and L-arginine to help support the production of healthy sperm. So there's some great things in here, including maca root to support libido. We have Breeder's Edge Get Him Going, which comes in a tube, and its primary goal is to improve his libido. So we have maca root and horny goatweed to improve fertility. We also have ashwagandha and niacin for energy and health, and then sarsaparilla root to reduce inflammation. So those are the thoughts behind these products and how they work. So if you have a dog with poor libido, he's not really getting the job done, this can be a useful short-term medication. So go for it. We have the Oxy Stud, the Breeder's Edge Oxy Stud, which you can use during peak breeding season when you're really demanding a lot out of your boy, that we're expecting him to be able to breed multiple females at the same time. So again, it has antioxidants to help repair damage to the testicles and muscle tissue. So it does improve that. And then we have Breeder's Edge in between. So when he's not actively in a breeding program, it's got B vitamins, iron, vitamin E, magnesium, potassium, all these 23 key vitamins and minerals to help support his overall health while he's recovering. So next time there's a breeding season, he's ready to go. Some of the other things that you can use, we use L-carnitine, which we find in a number of these products that improves the tail, not the tail of the dog, the tail of the sperm. So we see better swimmers, straighter swimmers, if we can get their tail straightened out with the L-carnitine. And then fatty acids is an anti-inflammatory like we find in salmon oil. So there's some nice products on the market that we can use. As far as snacks go, there's a lot of good ones on the market, but you just want to be careful that you're not doing anything. There's some question about flaxseed oil, peas, some of those things. So just be careful with your labels on what you're feeding. Surroundings and shampoos. We're going to talk about environment, disinfectants, and grooming. So the environment, you want to avoid extremes of heat or cold. We can see frostbite if we have the dogs out on too cold a surface, especially at around that 30 to 32 degree mark where it's slushy. We see dogs coming with frostbite of their scrotums. I've seen a dog that urinated and got his penis stuck to the metal fence. So you want to be really careful with these guys. I've seen dogs stuck to the truck bed with their scrotum. So be very careful with your stud dogs. They have a lot of value in their equipment, and you don't want any damage to the scrotum, to the penis, any of those organs that we really need for breeding. And then, of course, too much heat can cause the dog's scrotum to get too hot. We can see damage to the scrotum. We can see poor sperm production when the weather gets really hot. So we want to be cautious with that. Ammonia fumes, of course, are generally just not healthy for any part of the dog, respiratory or reproductive wise. So have good ventilation in your building, have the right humidity in your building, and then watch your stress levels. There are some male dogs that are a little bit on the shy side and can easily be intimidated by a dog that's next to them. If you're trying to breed in the alley in front of kennels, that's a bad idea. If you're trying to breed to a dog that's being intimidated by a male dog that's next to him, get him out of that environment. Let him go someplace that he's not going to be so stressed, or do something that has dividers in between so that the dog isn't like getting glared at by the next door neighbor and intimidated in a way that would keep him from wanting to breed bitches. Disinfectants, of course, you should be using disinfectants after you clean the kennel. Make sure that you're using the correct dilution, that you're rinsing it if it needs to be rinsed, that you're hosing it down. Make sure that you don't have residue, because if you have the wrong dilution and it's too concentrated, you can see damage to the scrotum. I think the peroxide-based disinfectants are probably the safest. I use a lot of chlorhexidine as well. So we've got a number of good ones on the market: Rescue, Wishy Wash, Novasan, a lot of good products on the market, but do follow the label directions. If a little is good, more isn't better. Read the label directions and dilute it down accordingly. You measure it, don't just go glug, glug, glug into the bucket. Grooming, of course, you want to be careful again with their scrotum. If you do use a shampoo, you want to rinse it very well so you don't leave any residue on the skin or around the prepuce where the shampoo may cause damage to the semen. And then, of course, if you're blowing him dry, avoid excessive amounts of heat on his scrotum. Again, we don't want to do damage, just like on asphalt or hot concrete. We can see blow dryers causing excessive amount of heat. And then we'll see things like bent tails, coiled tails from thermal extremes on the dogs. Females, we're not going to cover anything other than there's only really three categories of reasons that a female misses or appears to miss getting pregnant. One is, did fertile sperm get to a fertile egg? So fertility is really highly dependent on the male having good quality sperm, and we talked about some of those abnormalities last time. She, of course, has to have a fertile egg, and there has to be a good way for the semen to get there. So if you have sperm that isn't swimming effectively, that increased ability to deliver it with either a surgical or transcervical insemination can improve fertility. The next question is, did she conceive? So did the egg and the sperm meet in the oviduct and actually create an embryo? And then third is, does she maintain the pregnancy? And there's a lot of reasons that bitches can lose pregnancies, why they can not be able to maintain it. It happens with resorptions, it happens with abortions. There's a lot of things that can go wrong, but this sort of categorizes. So if you're having a fertility issue, you can kind of think through these three reasons. And then, of course, there's subsets of reasons underneath those, but it kind of helps you to define what you need to be looking for. This is a picture we took a number of years ago. This was one of our Bernese Mountain Dog clients. Again, many of us had more hair or less gray than we did back then. But this was a nice litter of 15 Bernese Mountain Dog puppies that a client had. She recently had a litter of 11. So she's pretty successful with her breeding program. So if you have a male dog that you're having fertility issues with, now remember, sterile is permanent, infertility is temporary. So we're going to call him infertile until we've done multiple collections and find that we don't have good quality semen or no semen. But if he's infertile, the first thing you want to do is do a brucellosis test to make sure he doesn't have brucella. The second thing we want to talk about is nutrition. So you want to go back to your Royal Canin or Purina diets. You want to look at the supplements that he's on. And it takes 90 days to grow a sperm from start to finish, 60 to 90 days. So if you're collecting them every week and you're hoping for some major improvement in less time than 60 to 90 days, you're going to be disappointed. You need to give time for the supplements, for the diet change, for all your environmental changes to give him a chance to kind of beef up again and get back to where he's producing good quality sperm. He needs some sexual rest. I had a client that I talked to a couple of months ago, and she was collecting the dog once a week. And so I think he was probably just exhausted. We need to give him a rest. If you're still not seeing any improvement in the semen quality, then you need to see your veterinary clinic and see if you can get some assistance. Does he have an infection? So don't just go willy-nilly putting him on antibiotics. Get a culture if you need one. Get a test for brucellosis. Get a good assessment. Does he have a thyroid problem? Does he have adrenal problems? You know, does he have a tumor in one of his testicles that's interfering with sperm production? Does he have prostate disease? Get a veterinary assessment, because your veterinarian can make diagnoses and treatment plans for you that can really help with semen production. You, of course, want to make sure he's overall healthy. He doesn't have Lyme disease. He doesn't have some other disease, heartworm. There's a multitude of diseases that can cause fevers and cause the dogs to not feel well, and as a result, not be able to produce sperm. You have to have a healthy body and healthy nutrition. You've got to feed the machine and have a healthy dog, because the first thing they're going to do isn't produce sperm. They're going to keep their brain, they're going to keep their heart, they're going to keep their internal organs working. Sperm is a little bit down the line as far as a priority. So get all those other cylinders all functioning well, and then culture the ejaculate and only use antibiotics if it's indicated based on your veterinarian's recommendation. Don't go reaching for the amoxicillin or the Baytril or the doxycycline just because you think he might have a problem. Get a veterinarian's assessment, find out what bacteria might be there, and find out what needs to be treated and treat appropriately. So in summary, at least twice a year, you should be doing a good quality semen evaluation. You can have your vet do it if you have the iSperm or another way to do semen analysis at your kennel. Go ahead and do that, but get it as twice a year semen analysis, because if you are seeing some fertility issues with a male dog and he has value to you, you want to get those problems controlled before he loses fertility. Once the semen is gone, once he's producing zero sperm, chances of bringing him back are pretty small. If you catch abnormalities earlier, low counts, bent tails, blood, white blood cells, anything in the ejaculate, you still have a chance of recovering this stud dog's fertility. So go in, get a veterinarian that's willing to work with you, and that's not always easy to find a vet that wants to do a work with breeders. I think breeders are awesome people. I love, love, love this. And to be honest, I've been in communication with a veterinarian last week. She came to the Therio meeting that is working with AVMA to try and improve the relationships of veterinarians with their breeders as clients. So we're working on trying to improve this, but find a veterinarian that will work with you. And you may have to drive a distance. If you don't, great. But if you do, find a veterinarian that is willing to work with breeders. Therio.org, which is THERIO.org, has a find a veterinarian feature on it. And then you can search by zip code, by species, by procedures. So use that resource. If you're living in an area and you're not sure who you can be using, don't just check on Facebook. Check with therio.org, and there are really great resources there for how to find a veterinarian that serves the species and the kind of procedures that you need done. Make sure you're feeding him well. Don't cheap out on your dog food. Feed really good food all year round, not just during breeding season. Make sure you've managed his environment, that it's clean, that the disinfectants are used correctly, that he's not stressed, he's not too hot, he's not too cold, he's not being stared at by another dog. Make sure you're keeping up with your brucellosis testing, and then use him conservatively but smartly. So don't breed him every single day to a bitch, and then switch to another and another and another. You're going to wear him out. Time your bitches so you know exactly when to put the semen in. And then if you are having a fertility issue, see that veterinarian that's willing to work with you and do the appropriate diagnostics and treatment to improve his fertility. It's really important that we do these things to keep your stud dogs in good shape. Your stud dog is a valuable resource, keeps you from having to pay other people for stud services. They're really important to your breeding program. Take very good care of your boys. They earn it. It's not just twice a year you need them. It's every day you need to take good care of them. So your stud dog program, again, we talked about semen analysis, semen collection and delivery, scratching the surface, stud dog variation, screening for health. Don't forget brucellosis, feeding them appropriately, and taking good care of them. So the last thing I want to talk about is just going to be very brief. This pertains to people that have AKC dogs that may have frozen semen, or that you have a valuable dog that you may want to freeze semen on or have already frozen semen. The AKC is now providing financial assistance to people that no longer want to continue to store some or all of their semen. Whether you're retiring from breeding, whether you've got more semen on a dog that you ever want than you ever want to use, whether you've changed breeds, whatever it happens to be, if you have some semen from a stud dog, AKC is setting up a program. There's a lot of misinformation floating around out there. So please go to the AKC Purebred Preservation Bank website, look for the webinar, watch the webinar that's already recorded. And then I am happy to, as our other people on the board at the Purebred Preservation Bank, in speaking to your breed club, either in person or on a Zoom call or whatever device you choose. And we will be able to help your breed club figure out how to make this work. AKC is not deciding who uses your semen. Your breed club decides that. So work with the genetics committee or set up a committee or your, whatever committee you have at your breed club. So if you have a stud dog that you think has value to the AKC for future use, I want you to think about donating your semen. You would donate it to them, but they would pay for the rest of the storage. And I don't want you to think about what happens next year with your breeding program. I want you to think about what happens 100 years from now, when you're long gone, your dogs are long gone, and the value that some of your dogs will provide for future breeders. It's about what happens 25, 50, and 100 years from now, not what happens tomorrow. Their mission is to protect purebred dogs and the breeds for future decades. So please take this seriously and go to your breed club and see if you can be on a committee to help work that out, because we are very serious about making this happen. A couple new products I just want to mention. They've been out on the market for a little over a year. We have nursemaid wipes, which are a safe product to use on the mammary glands of females and around her vulva. So after she has puppies, to keep her clean, reduce the risk of mastitis, keep the puppies clean, those nursemaid wipes are safe. We have the Clean Cut Cord Care, which is an iodine gel that you can put on the cords of the puppies. We've talked about this in previous seminars about keeping those cords clean so that they don't end up with an ascending infection. And then we have this really cool new probiotic product for babies. It comes in a gel in the tube. It's called Nurture Flora. It has some nice products in it to get the right bacteria into the GI tract of your puppies so they get off to a good start.
Now, let's get to the questions. We do have a few questions here. Cindy is wondering, she said she has a stud dog who has anorexia, and he's on medication that she doesn't give him real often because it makes him pretty lethargic. She gives him a good diet, but she's not really sure if it's kind of a hit or miss if he'll eat or not. So she's wondering, do you have any tips on how to get him to eat? She feels like she's done everything.
Well, first you want to make sure he's healthy. Secondly, when I have dogs that are poor eaters, oftentimes it's because they have a food sensitivity, not quite rising to the degree of a food allergy, but it can be a food sensitivity. So talk to your veterinarian about a hydrolyzed protein diet to see if that for 8 to 12 weeks will make a difference. There are some medications that you can use that will keep them from becoming lethargic. Mirtazapine and Entice are some of the products that we have on the market now. But first, see your veterinarian and make sure he's healthy.
Okay. Deanna's wondering, are there effective natural flea and tick prevention products for areas that are a high risk for tick diseases?
Not that I'm aware of. I don't think they're mostly effective. I stick to the products that we've talked about earlier today.
Okay. Cindy's wondering, is Bravecto chews safe during pregnancy? She says her vet office says not during pregnancy. She's wondering about those Bravecto.
It is labeled safe, and I have used it on my own pregnant dog. So yes, they are labeled as safe. You can go to the PDF of that. So Google it and go to the PDF, and it's in there.
Awesome. Thank you. Christine is wondering, can fresh chilled semen be shipped overseas? She has someone in France.
Yeah, sometimes. It depends on how long it takes to get through customs and how long the semen will stay good. Some dogs will stay good for a few days, and so you may be able to get it through. It's a little risky going overseas, but sometimes it's worth it. What's the worst thing that happens? The box gets lost, you miss the breeding, but it's worth a try.
Okay. A different Christine is wondering, what type of extenders should they use? Are some better than others? Do you have any that you recommend?
Yeah, we carry one at Revival called Kenny. It is a milk-based extender. There are some that are egg-based, some of their other based. Symbiotics makes one. Minitube makes several. Camelot Farms makes one. There's a number of them on the market. Some dogs do better in one extender than another. A healthy dog will generally do good in any extender. But if you want to do some test chills, so maybe order 2 or 3 different kinds, chill the semen, pull it out of the refrigerator, 24, 48, 72 hours, warm it up and look under the microscope, because some dogs will do better in one than the other. And I can't predict that. It depends on the dog.
Okay, absolutely. Cindy's wondering, she says she's new to breeding and she needs to find the perfect male and she doesn't really know how to start. Do you have any tips there?
Oh yeah. That's a challenge. I usually recommend that you find a mentor that it doesn't have to be in your breed, a mentor that understands how to read a pedigree, how to look at a breed standard and see what qualities your dog has and needs. We have a whole bunch of information on the Learning Center that goes through selecting these dogs. So as basically bottom line, find somebody that's willing to help you figure it out.
Okay. Someone's wondering what % of viability on a test thaw is acceptable? If the semen is good, but the test thaw is poor, what can they do?
If you thaw the semen and it's poor, it's poor. We want to see 60 to 80% motility post thaw. That if we're talking frozen semen, once it's warmed up, you should see 60 to 80% swimming. If it's under 60%, I get a little bit more worried. But there are some females that'll get pregnant with 20%. They have to be pretty fertile and we have to have a lot of sperm. But there are some dogs that's enough.
Okay. Someone is wondering, are there ways to support prostate health, especially with males that are housed with females?
Right. So if he's over age 5 and he starts to develop prostate disease, you want to speak to your veterinarian about putting the dog on finasteride. It is a prescription medication. And then we have the products that we talked about, the Oxy Stud and the Problem Male that can be very helpful for those dogs.
And Judy is wondering, she's asking about the nursemaid wipes, the Breeder's Edge nursemaid wipes and how those are helpful for the female. Can you talk a little bit more about those?
Sure. So mastitis, as you know, is a pretty serious condition. We don't see it frequently, but we certainly do see it often enough. I've got a dog here today that's recovered from mastitis. So this will reduce the amount of bacteria and debris on the skin of the female, but safely enough that the puppies can still nurse on those nipples. So it's a good way to keep her clean. We do recommend that you bathe her several days before she has her litter and then keep her mammary glands clean, keep her out of the mud. My husband once took one of our dogs up to the pasture 3 days after her C-section to help him load sheep into the trailer. I was somewhat horrified. Fortunately, she didn't get sick, but it was a little bit risky for him because I was about ready to strangle him. So it is a really nice product to keep the bitch clean and to let the puppies still be able to nurse.
Make sure to check out our Learning Center. Give us a call. Give our animal care specialists a call, and they would be happy if you think of another question that we didn't get answered today. So thank you again, Dr. Greer, for being with us today. We appreciate all you do. Again, my name is Shelley. I'm the content manager at Revival Animal Health, and we hope you all have a great rest of your day.
Thanks, everybody. It was good to see y'all.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.